Hey guys, welcome to the Mentoring Minute. Marshall and Mike here from PhysioU, and this week we're going to be talking about meniscus tears. Right, when we think about meniscus tears, it kind of separates into two separate categories. We have the more unstable, acute, traumatic meniscus tear. Then you have the more degenerative, older population meniscus tear. And the research is pretty clear. Multiple RCTs come out with over hundreds of patients that say that partial meniscectomy, arthroscopic meniscectomy, is no benefit, no difference than an exercise program lasting longer than 3 months. What they found in this nice RCT that had over 700 patients, in the group that had arthroscopic surgery, in the first 3 months and 6 months, there was a benefit compared to the exercise group, but there's no difference at 12 months and then at 24 months between the two groups. So what we can use that for is if our patient's coming in and they're over 35 years old, there is no traumatic event, then we can say, oh, prognosis is they might benefit from working on strengthening and mobility deficits for the knee with good results. When we talk about diagnosing meniscus tears, the research talks about each individual test itself not being great with the sensitivity and specificity, but if we can kind of link them together, as well as the history of being older and imaging findings of osteoarthritis in the older patients, those together as a clump make good diagnosis measures for looking at meniscus tears for these older generation with degenerative meniscus tears. And the two tests that they use is the McMurray's test, which we're going to internally rotate the femur, externally rotate the tibia, right? Create like a rotation at the knee, and then kind of move from flexion to extension. And then vice versa, if we externally rotate the femur, internally rotate the tibia, adding pressure on the medial side, and then going from flexion to extension. Right, we're looking to see if we can provoke pain at the joint lines. The other test that they use is the Thessley's test in standing, which we'll show you in a second. So for Thessley's test in standing, have the patient place their hands on your shoulders. You can hold their pelvis, lift this leg in the air, bend this knee about 25 degrees. Keep that bent there. And we're just going to rotate you one way, rotate you the other way. We're going to do it 3 times, keeping that knee flexed, looking for reproduction of symptoms. In an article that looked at what's the best treatment for patients with degenerative meniscus tears, the prescription was trying to improve range of motion and then improving quad strength as well as cycling. So one of the ways that they improved flexibility and tried to improve knee flexion was using kind of a gapping mechanism. So either your hand or a small towel under the knee and then working on oscillation overpressure. So not necessarily doing holds, but more repeated movements. Nice thing is, this tends to improve range and can be easily reproduced at home by having the patient stick one hand underneath and the other hand underneath. If they're not long enough arm-wise to do it, then they can always use a sheet or a belt, and again, a towel roll. Right, and just working on end range flexion with the gap. Right. There's another article that looked at manually what can we do to improve flexion, and they call it the Mulligan squeeze technique, where they had patients starting in flexion, right, and then placing your thumbs over the anterior part of the joint line, and kind of squeezing down inward towards the joint line, and then having the patients extend their knee all the way. As they extend, I come out of the joint because the joint's closing down. And then as he comes back up, I'm squeezing, squeezing, squeezing. And then he overpresses with his hand, right? As I'm trying to squeeze the joint internally. And then as he lets it go, I let it out. Squeeze, 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 right? Deflection. And they call that the Mulligan squeeze technique. Besides working on mobility, we want to work on quad strength. So having patients do long arc quads, so kicking out, activating that quad against the black TheraBand, nice, slow, and controlled. 10 to 12 reps, 3 sets, 3 times a week was what they used, their protocol they used in the article. Besides the flexion, the quads, the last thing they had to do was riding a stationary bike, so cycling 25 minutes, 3 times a week. Again, working on the overall cardiovascular system, but also just mobility and strength. Now, for the other group of patients with meniscus tears, the unstable, more acute traumatic younger, research was clear that actually partial meniscectomies, arthroscopic surgery, was more beneficial than a PT group. And what they used was about a 3-month tester. So the patient comes in, 3 months of working with them. If there's no change in their symptoms, then it may be time to kind of refer them to orthopedics. All right. Take care, guys. I hope you guys enjoyed Mentoring Minute on meniscus tears. If you want to learn more, take a look at PhysioU, take a look at our website. We have all the stuff you need in there. Take care.